dive straight into my highlight.
Matthew Broom from Coherent Vision. Talking about commissioning, about where commissioning comes from, obviously at present it's relatively easy within the Commodities Act to go to the PCT to get things like interpreters and different things, applying people, etc., etc. Where's that going to come from in the future? Is that going to be local authority, or is that going to be GPs, or is that going to be, where are we going to go for that?
Well, Brian and Anne might give a view on this, but I think in terms of interpreting services for NHS services, I think it will come via the NHS budget. What I see is a government that is drawing a line between NHS care services and a budget focused on NHS care services, and a system around wider health improvement and public health that is separate. Locally, we have got to work together, but in funding, which is I know where you're coming from, I think you will see clear distinctions about budgetary responsibility. However, because of the complexity of untangling this, is one of the earlier questions put, there is a real danger that we'll just miss things out, we won't have thought them through. And that's why I was trying to convey to you that we've got to get beyond the sort of high-level changes, and it's difficult enough to understand those, but I can assure you every single, if you like, budget line and service is going to have to be really thought through, who's doing what for the future. So I think you are right to be concerned, and you've really got to constantly throwing responsibility back to ourselves. Is, are you thinking about this? Are you including this when you're thinking who's doing what? Because there is a danger things will fall through the net.
See you. The lady on the back table there.
Hello, my name is Julie Newsom. I'm also from Coherent Vision with my colleagues here today. My concern is about budget responsibility, more for the individual. For example, in my experience working in health and social care, if somebody is admitted to hospital, they have an assessment, it's there in black and white from the consultant, psychiatrist, that this person needs specific support, specific accommodation, etc. To then discharge from hospital and become the local authority responsibility. The local authority acknowledge the support needs required, but often, in my experience, don't have the funding to support that person. So my concern is, where can you reassure me today that the individual is not going to suffer, because whose responsibility do I become?
Well, in terms of responsibilities, in the problems you describe about the current system, I mean, those problems, A, won't necessarily go away in the future, if I'm being candid. There is a need for the new commissioners, the GP consulted commissioners, to continue to work in partnership with the local authority around the interface issues. The problems the local authority faces, I think we all know, they are going to be hard hit by budget restrictions. Now, there is a drive, though, by this government, as John was highlighting, about, if you like, forcing the NHS to work much more closely with the local authority. You will know from, if you've been in Leeds a long time, and sometimes there's been Berlin walls between them. And really, because we've all got financial problems, and we've got to clearly meet the needs of the public, the new system is going to make the agencies work more closely together, think more creatively about sharing budgets and ways of working. And I'm not going to defend the government here, but one of the drivers is to make people work more closely together. to ensure that the problems we have now at least don't get worse in the future.
The lady on the back table there, yes, thank you.
Hi, I'm Helen Jones from Leadership and Traveller Exchange. I'd like to go back to the answer to the first question from Coherent Vision. I was quite surprised by the response, which didn't mention my understanding that in future GP consortia will be regarded as public bodies for the purposes of the Equalities Act. And I would have thought that that was the answer to the question, because does that not mean that actually the GP consortia themselves are responsible for ensuring that equalities issues are dealt with, and who's accountable for that? I wonder if Dr. Cameron has heard of, or maybe it's already been buried, the Department of Health's Equality and Diversity Delivery System, which was raised a while ago, and I know members of the Department of Health have been working on. So I'd just like to hear a bit more about how does equalities duties fit into this system, and where is our route into ensuring that equalities issues are recognised and we have a route to deal with them.
Well, of course I do know about the changes. Clearly, in terms of improving health, ensuring that equality and diversity is a critical part of improving health and reducing inequalities that we've got in the city. You are right, of course, that the consortia are going to be a statutory entity and do have to take responsibilities to comply. What I was being asked about was around where budgetary responsibility is going to fall, because money is being spent now. And I interpret the question, which I think is a very legitimate question, in services are being provided now, and who is going to have funding responsibility for them in the future? And my answer is it will still be through the NHS, and it will be through the GP consortia to do it. So I was replying back a fear, not in terms of complying or otherwise with the Act, but about the hard-nosed practicalities of where budgets currently lie and where they're going to be in the future. Because I do have concerns that some budgets and responsible will just slip through the net because there's the complexity. So if I've answered the question in a way that you didn't want me to, I apologise for that, but I was trying to be harder-nosed and more practical about current funding and where it might go in the future.
Thank you. Gentleman at the back.
Alex Boyd from Leisure, which is Applied Chinese Movement. We're a charity, and I think for everyone it'd be useful to know what criteria there might be to become an independent health provider within this new framework. In particular, what the Care Quality Commission criteria might be in order to achieve that status, to be able to be in a position in which to tender for future commission work.
Right, well, really very, very good question. To be honest, all these things are going to have to work through. John has said about the bill, it is incredibly complex, and even just reading the responsibility of the Care Quality Commission, quite frankly, I find them very, very difficult to understand. We are clearly going to have to be transparent about the criteria as commissioners, and I'm using us all here from public health and GPs. We're going to have to be absolutely transparent about how we commission, because there is a danger of, dare I say, conflicts of interest. What the Department of Health have said, they've said that there's going to be new guidance coming out for commissioning. And I don't know when, hand on heart, I don't know when it's coming out. They just announced that when they published the bill. But from your sector, I can see you would be looking for the transparency, the criteria, you know, how you get on the books, if you like, of being a potential provider. To be frank with you, I say work in progress. That's perhaps, I think it's work to be done. It's probably a fair answer. What I would like to just chip in, if I may, and just throw in another point that's come from your comment is, there is yet another consultation document out from the NHS. It's another one under the title Liberating the NHS, but it's actually about the healthcare workforce, which you might not think is that interesting. But from your sector's perspective, the training, the way it's funded, is going to be very different in the future. And there are some questions there that are posed that I would have thought that the voluntary sector would be interested in, because it includes duties for services that are funded by the NHS in terms of having to provide data around workforce back into the new networks. And I found it, and there are some questions for the local authority in there. And I'm raising that because it's one of the many documents that probably you see the title of and you just ignore and think it's just the NHS. But actually there's a bit more in it. And if you are being funded by the NHS at the moment, I would suggest having a look at that document, and some of the questions about workforce development might be things that you would want to make sure you're engaged in, because they're going to be the creation of new local health networks around workforce training and development, and you may wish to get engaged in those.
Thanks, Ian.
Hi, Jo Thorpe from Health Living Network. My question was a little bit from the last question. In that, it does seem a great opportunity. We said there's lots of opportunities to actually access health services, and we can deliver some of those services. The crunch point comes about how we market our services, and if you don't know what we do, how do we get you to know that? We don't particularly have always the big glossy brochures. We can't always wind them down like private sector companies might be able to. We're busy doing, we're not always busy selling, because money's tight. And yet we want to do that, we want to be able to sort of support you in achieving those indicators. You did say that one of those ways might start collecting that information now. I think that's a really, really good point. Would the panel have any other suggestions, bearing in mind our constraints as organisations and as a sector, how we could start gearing ourselves up now to be able to showcase on a level playing field, because it doesn't feel like a level playing field right now. What advice would you give?
Well, over the years, I've done a number of presentations to the voluntary duty face sector, and this issue of how do commissioners understand what you do. For me, I'm speaking personally here, from a commissioning side, it's having a state of mind that values and respects the contribution the sector makes. In my previous life was around mental health and learning disabilities and people with physical disabilities, and you know the contribution the sector makes. If I'm candid, working in an NHS organisation, there is not that similar empathy and understanding with all commissioners. So, in the end, it's a hearts and minds job that is going to be needed to the new commissioning leads, making them understand the part that you play and how you are linking into much more embedded into the local communities and meeting the needs of local people. So I would hope that, following on Brian's comment to an earlier question where he was saying, GPs are closer to the ground, do have a greater understanding of some of the issues that the patients have. I use the word patients there deliberately. And hopefully you will find a more sympathetic arena than perhaps you have faced in the past. I think it's about a cultural shift. Now, Councillor Dodson was talking about the Health and Wellbeing Board and at the first meeting, the steering group we had. Now, we had a series of councillors and we've got a series of GPs, and there are different views of the world. And we recognise that we are going on a journey amongst ourselves to learn about each other's roles. And we talked about our next session being a kind of myth-busting session and getting out on the table what everybody thinks of everybody. And I think there is work to be done. The sector should not be passive. It has got to, as a collective voice, demonstrate to the new commissioners the role that the sector to play. Because I'm, from a public health side, I have no difficulties with that. But I can understand why you're asking the question, and there may be work to do. So I think it is about having a collective voice and keep having the message on a long-term basis.
I'll take the and also from the local elected members' perspective, whoever is ultimately responsible for commissioning your particular service after the changes, I think one thing that is very clear is that sometimes the pathways into local organisations hasn't always been particularly well driven from local authorities as well. I always say the same thing, that a few members of the authority, in terms of councillors who are on board and understand this agenda, but I always say the same thing, there's 99 of us for 33 wards, and in some regards, we are the most underused resource. Because in terms of communities, if you're a good councillor, and I believe the vast majority of us are, you understand what's going on the ground, on your patch, who's delivering what services, and one of the things we did discuss in the regional steering meeting last Monday, Monday last, was around elected member involvement. Clearly, we can't have 99 people sat around the table, but what we can do is push the strategic vision of the Health and Wellbeing Boards to the area committees and out into communities, into the ward forums, and then get that feedback. So I can be saying, perhaps feeding back into LWB, saying, this is a fantastic organisation, this is the work we do, come and have a look. And it's about creating better links. To my shame, actually, I have to say, is elected member for Gareth from Swinton. I've had some interaction with a lot of Swinton GPs around some of the changes that happened there. But I've never actually gone into my GP, sat down with them and said, what do you think our key health issues are in this town? So for that, we're going to see if we agree on any commonality. Never done that. And I think from our perspective, we've also got to raise our game as well. In fact, I did see that.
Hi, I'm Kathy from Leedsgate, and just in response to your question and the answer that was posed or given, appealing to people's hearts and minds, I don't think is sound advice, or what I've been talking about this morning is what is in the contents of the wallet. So, although we do appeal to people's hearts and minds and communities, I think the big question that was raised earlier was about the willing providers. And what we're aware of is there's some sharks in the waters that are prepared to be willing providers. And how can we effectively and fairly compete with them in what will be an open market?
Yeah, it will be hard-nosed. I'm not disputing what you're saying there, but the point I was trying to raise was, if you are meeting people in the new world who simply do not understand the contribution that the sector can make, you're on a losing track from the word go. Of course there's going to be a hard-nosed process. And I was not hopefully intending that it's all going to be soft and lovey-dovey, but what I was trying to convey was, I think, from my experience in Leeds over many, many years now, I still think there is work to be done to market, communicate the incredible role the sector does. And there are going to be new commissioners on the ground, and that is why I'm saying that is still important. You're right, of course, there is then going to be a process for commissioning, performance management, which will be looking at outcomes and value for money. I'm not denying that, but I still believe that the sector, it will be to the advantage of the sector to make sure the new commissioners are fully aware of what you can offer.
Let's take one more question before we sorry.
I think it's really important, the last message that Ian has just given. And there are a large number of people providing services, and certainly at general practice level, most of them will be not known. And when we are in a position at some stage in the future of informing our consortia about what they might need to commission, we actually need to know what there is out there. A, for signposting, and B, so that we can actually look and appraise at what there is to offer in the way of services, and then therefore where we will put our commissioning intentions for the future. And the other thing is, it's not going to happen, the PCT isn't going to shut up shop tomorrow and GPs suddenly will start to do this. It's going to be a process which we've got 2 years in which we've got to learn an awful lot. This is not my job. My job is actually caring for my patients. This is something which we are doing because we passionately believe that we can make things better. But we actually need the information. So we need the voluntary sector to be going and say, this is what we are providing, and this is what outcomes we are getting out of what we are providing. We may well find that there are gaps that other organisations might want to come in and fill, but actually we don't have a very good awareness of the spread across the city of the provision of these services, and actually the breadth of them as well. So it's a real plea. If we have something that we can manage intelligently with what there is out there, then we can probably better commission services for the people of Leeds for the future.
Thank you. Even by my standards, we've run over some more. But I'm going to take 2 more questions. If you have brief questions and brief answers, the chap, if you put your hand up again. Yep. And then the lady in the back corner there.
I'm David Fleming from near Yorkshire. I provide a movement form that has benefits for both health, wellbeing and fitness. So I was looking at the Health and Wellbeing Board. There's a Director of Health. Is there a Director of Wellbeing? That's my question. It relates to preventative rather than as well as clinical. So I'm just checking it out.
We could get into definitions here.
Yeah.
The important part is that the Health and Wellbeing Board will cover what we could call health improvement, reducing health inequalities, health protection, as well as healthcare, social care services. So that's for adults and children. So the board is not just about a focus on, if you like, health improvement and health and well-being. One of the points that Councillor Dobson made in the importance of this board and really making it work for Leeds is we have got to make sure that health services and local authority services for social care with adults and children are wrapped under that board as well as health improvement. And the board will also be thinking broader than just a public health ring-fenced budget. So you'll see the range of services there, But the intention is we've got an ambition greater than that, and we've got to be thinking about the resources that the local authority have right across the pitch in terms of what its contribution is to well-being. So that includes the impact of planning, licensing decisions, the work that happens around regeneration. So our ambitions are far greater than a narrow remit on health and well-being, and it certainly includes services as well.
Thanks. And finally,
hello, Norma Thompson from NHS Leeds. I just wanted to sort of add something to what Anne was saying and what people in the room are saying about how do we enable the consortia to understand what we do, and how do individual GPs start to understand what is there in their patch, or in fact individual elected members. The Adult Social Care and currently the PCT fund infrastructure organisations to support voluntary sector organisations to do some of that interface. And I would want to suggest that we use the capacity within the infrastructure organisations over the next year to 18 months to have them bring together information in a sort of structured way that would enable the new partners who are going to be sitting around those boards to understand what is actually in their area doing what for whom, and that feels like it's something that could link possibly with the locality health and wellbeing partnerships, but actually do a structured exercise over a period of 12 months to make sure that even the smallest organisations have been able to say who they are and what they do, because we recognise the capacity within organisations is so varied. It's really not going to be possible for them to be knocking on the local GP's door necessarily.
I just think that's a very helpful suggestion.
thanks, Ian. And as slightly over time, but after the break, we're picking up with Brian Powell from HD Plus. I'm sure it'll be stimulating debates there, at least. And